Good evening. My name is Luzina Koa. I'm a constituent. I'm here today as an advocate for obesity intervention implementations in schools. For the past 3 years, I have worked on the cardiac step-down unit within the Methodist Hospital. During my time, I had cared for patients that were obese. Some patients that I provided care for had to use specialties beds to accommodate them because regular sizes could not. They needed assistance with personal hygiene and couldn't sleep lying flat. They had to sleep sitting up because breathing was most difficult at any position other than sitting up. Walking is hard for them, and even though they were very alert, but they have poor quality of life. Many are young people who have had so many heart surgeries, ranging from implants to open heart surgeries. The government spends billions of dollars on medical expenses that are linked to obesity. In 2000, the cost of medical care related to obesity was approximately 117 billion. According to CDC, the prevalence of obesity has dramatically increased over the years between the ages of 2 to 19. The prevalence of obesity was 18.5% and affected about 13.7 million children and adolescents. Childhood obesity also is associated with social and psychological problems, such as discrimination and poor self-esteem. Obesity is a problem within the United States that needs a serious attention, and I believe that if attention is given to the root cause of this problem, there can be a lasting solution. Some root causes of obesity are unhealthy diet, lack of exercises, and health education, all of which can be addressed in school obesity intervention programs or wellness programs. Schools can provide exercise periods, health education that provides healthy eating plans that involve kids, and place them in control of their health. There is no better place than a school to implement a wellness program because kids spend all their time at school, from Monday to Friday, 8 to 3 p.m., and for some even more times than that. The government has the resources to create and support policies that have goals to end this problem. With that said, we need the government financial support to please fund these interventions and wellness programs in schools. With the collaboration of everyone, we can create a healthy future for our kids to prevent poor quality of life now and in the future. Policies that will create environment for kids that are healthy. Thank you.